Welcome to the training on Occupational Health, Environment and Safety. Let us learn the module on First Aid for Fracture. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to define fractures and types of fractures, recognize and list the symptoms of fractures, demonstrate first aid to be given for fractures. Let us first know what is fracture and what causes a fracture. A fracture is a broken or cracked bone that can be caused by an accident, fall or blow. It is caused by direct force, indirect force and muscular action. It occurs when pressure is applied to bone. It sometimes creates bone fragments. Now, let us see some common types of fracture. There are mainly two types of fractures. Simple or closed fracture. This is a condition when the break or crack has not injured any other tissue and the skin is intact. Compound or open fracture. This is a condition where there is a wound leading the fractured bone or the broken end of the bone has come through the skin. We can recognize a fracture by its signs and symptoms. Let us now see what are the signs and symptoms of a fracture. If you fall from a height or fall heavily, you may get fractured. You should call for medical emergency if the following symptoms of fracture appear. Pain on gentle pressure or movement, the limb or joint appears deformed, the bone has pierced the skin, the person is unresponsive, isn't breathing or isn't moving, there is heavy bleeding, the extremity of the injured arm or leg, such as a toe or finger, is numb or bluish at the tip. You suspect a bone is broken in the neck, head or back. You suspect a bone is broken in the hip, pelvis or upper leg. For example, the leg and foot turn outward abnormally. Let us now learn the steps to administer first aid in case of an open fracture. Remember, don't move the person except if necessary. This helps avoid further injury. Step 1. Stop bleeding. Hold a clean, preferably sterile, absorbent material over the injury and apply gentle yet direct pressure without applying over the break. If there is a large object penetrating the skin, do not remove it. Step 2. Cover the wound with a sterile cloth. If the bone is protruding, cover with clean cloth once the bleeding is controlled. Step 3. Treat for shock if you see symptoms of shock. If the person feels faint or is breathing in short, rapid breaths, lay the person down with the head slightly lower than the trunk and, if possible, elevate the legs. Step 4. Get medical attention. Have the injury treated by a physician or a qualified medical professional as soon as possible. Let's now learn the steps to administer first aid in case of a closed fracture. Step 1. Immobilize and support the injured area using a splint. Reduce the pain and the risk of further injury by supporting and immobilizing the injured area. Support the injured area by using a splint. When applying a splint, do not attempt to straighten the break. You can make a splint when using something rigid in order to stabilize the fracture. This could be rolled up newspaper, a heavy stick, a board or plank, or a rolled up towel. Use shoelaces, belts, ropes, and strips of cloth to fasten. Step 2. Support and comfort the patient. Help the patient into the position of greatest comfort without any unnecessary movement. Use blankets, pillows, or clothing for general comfort and support. Step 3. Apply ice packs to limit swelling and help relieve pain until emergency personnel arrive. Don't apply ice directly to the skin. Wrap the ice in a cotton towel, piece of cloth or some other material. Step 4. Treat for shock. If the person feels faint or is breathing in short, rapid breaths, lay the person down with the head slightly lower than the trunk and, if possible, elevate the legs. Now, let us see what we should not do in case of a fracture. Do not massage the affected area. Do not try to straighten the broken bone. Do not move without a support for the broken bone. Do not move joints above or below the fracture. Do not test a bone's ability to move. Do not give oral liquid or food.
Hi, my name's Daniel. I'm an EMT. What happened here?
I had a skateboarding accident. My arm really hurts.
What's your name?
Carol?
Alright, first thing I'm gonna do, can you sit up? So, okay, alright, first thing I'm gonna do is, I need air it to make sure I get all any foreign substances that are in it out of the wound, alright? Alright, okay, here, if you could apply a little bit of pressure. Okay, stop bleeding. Alright, let's see. Still bleeding through a little bit here. Apply more pressure. Go rapid, okay? Okay, I'm gonna have to apply split now, right? Make sure it doesn't move or worsen from there. Can you hold that for me?
What are you doing? What are you doing?
So what kind of tricks were you trying to do up there?
I was trying to grind the rail.
You getting good air?
I got some mad air off the end, yeah. And I ended really badly.
Alright, well, we're taking care of you right now. At this point, I'm gonna request ALS come here, and they'll take you to the hospital, right? Get that looked at.
Alright. Am I gonna lose my arm?
Nah, from the looks of it, I'm pretty sure you'll be alright. So, at this point, I'm going to apply splint, alright? I'm going to have you hold your arm up as high as you can. Okay. Alright, I'm going to check CSM real quick. What finger am I holding?
Nothing.
Alright, keep to my hand. Alright. Are you pulse? Alright, ALS has arrived, so.
Hey, this is ALS. What happened here?
Got this 25-year-old female. She was skateboarding. She hit the bench and she had the open fracture on her arm. There weren't enough time to take her out, but we'll do that in route to the hospital.
Where are you now? What time are you reaching? You have a meeting in 5 minutes. Oh no. Sir, you're right. Sir, are you okay?
A fracture is a broken bone. It requires medical attention. If the broken bone is the result of major trauma or injury, call your local emergency number. Don't move the person except if necessary to avoid further injury. Apply ice packs to limit swelling and help relieve pain. Do not apply ice directly to skin. Wrap the ice in a towel, a piece of cloth, or some other material. To support the fractured arm, use the technique of the triangular bandage. A fracture is a broken bone. It requires medical attention. If the broken bone is the result of major trauma or injury, call your local emergency number. Don't move the person except if necessary to avoid further injury. Apply ice packs to limit swelling and help relieve pain. Do not apply ice directly to skin. Wrap the ice in a towel, a piece of cloth, or some other material. To support the fractured arm, use the technique of the triangular bandage.